dies with death. Healthy adults taking irregular doses of paracetamol up to 4 grams a day show little evidence of toxicity. Some researchers disagree. According to them, they are more likely to have abnormal liver function tests. But the significance of this is uncertain. Acute overdoses of paracetamol can cause potentially fatal liver damage. In 2011, the U.S. Food and Drug Administration instructed manufacturers to update labels of all prescription combination acetaminophen products with acetaminophen can cause serious liver damage if more than directed is used. Paracetamol toxicity is the foremost cause of acute liver failure in the Western world. Paracetamol is metabolized by the liver and is hepatotoxic. The risk may be heightened by frequent consumption of alcohol. Toxicity are very likely in chronic alcoholics or patients with liver damage. Some studies suggest the possibility of a moderately increased risk of upper gastrointestinal complications such as stomach bleeding when high doses are taken chronically. Kidney damage is seen in rare cases, most commonly an overdose. The Food and Drug Administration has warned doctors against prescribing paracetamol narcotic combinations whose dosages exceed 325 milligrams of paracetamol due to hepatotoxicity risks of greater magnitude than the therapeutic benefits conferred. On August 2, 2013, U.S. Food and Drug Administration issued a new warning about paracetamol. It stated that the drug can cause a rare, but possibly fatal, skin reactions, such as Stevens-Johnson syndrome and toxic epidermal necrolysis. There is an association between paracetamol use and asthma. The evidence suggests that this likely reflects confounders rather than a causal role. A 2014 review found that among children the association disappeared when respiratory infections were taken into account. As of 2014, the American Academy of Pediatrics and the National Institute for Health and Care Excellence continue to recommend paracetamol for pain and discomfort in children. But some experts have recommended that paracetamol used by children with asthma, or at risk for asthma, should be avoided. In contrast to aspirin, paracetamol does not prevent blood from clotting. It is not an antithrombotic, so can be used in patients where failure of blood coagulation is a concern. Paracetamol does not help reduce inflammation, while aspirin does. Compared to ibuprofen, paracetamol has fewer adverse gastrointestinal effects. Unlike aspirin, paracetamol is generally considered safe for children. It is not associated with a risk of Ray's syndrome in children with viral illnesses. Paracetamol when taken recreationally with opioids may cause hearing loss. Untreated paracetamol overdose results in a lengthy, painful illness. Signs and symptoms of paracetamol toxicity may initially be absent or nonspecific symptoms. The first symptoms of overdose usually begin several hours after ingestion. Starting with nausea, vomiting, sweating, and pain as acute liver failure sets in. People who take overdoses of paracetamol do not fall asleep or lose consciousness. People who attempt suicide with paracetamol wrongly believe that they will be rendered unconscious by the drug. The process of dying from an overdose takes between 3 to 5 days to 4 to 6 weeks. Paracetamol hepatotoxicity is believed to be due to its quinine metabolite. Untreated overdose can lead to liver failure and death within days. Treatment is aimed at removing the paracetamol from the body and replacing glutathione. Activated charcoal can be used to decrease absorption of paracetamol if the patient presents for treatment soon after the overdose. While the antidote, acetylcysteine, or N-acetylcysteine or NAC, acts as a precursor for glutathione, helping the body regenerate enough to prevent or at least decrease the possible damage to the liver. A liver transplant is often required if damage to the liver becomes severe. NAC also helps in neutralizing the imidaquinone metabolite of paracetamol. Kidney failure is also a possible side effect. There are paracetamol tablets available combined with an antidote, methionine, to protect the liver in case of an overdose in patients with suicide tendency. In June 2009, U.S. Food and Drug Administration Advisory Committee recommended the maximum dosage at any given time should be less than 1,000 mg to 650 mg to protect people from potential toxic effects, and the combinations of paracetamol and narcotic analgesics should be prohibited. In January 2011, the U.S. Food and Drug Administration asked manufacturers of prescription combination products containing paracetamol to limit the amount of paracetamol to no more than 325 mg per tablet or capsule and began requiring manufacturers to update the labels of all prescription combination paracetamol products to warn of the potential risk of severe liver damage. Experimental studies in animals and cohort studies in humans indicate no detectable increase in congenital malformations associated with paracetamol use during pregnancy. Additionally, paracetamol does not affect the closure of the fetal ductus arteriosus as NSAIDs can. Paracetamol used by the mother during pregnancy is associated with an increased risk of childhood asthma. It is also associated with an increase in it, but it is unclear whether the relationship is causal. Despite these concerns, paracetamol remains the recommended medication for pain and fever during pregnancy. Better safe than sorry.